Hello everyone, this is Jana with Yama Mamas, and I'm going to talk to you today about 4 ways that people talk about their birth. So the first is a natural birth versus a cesarean birth. So a natural birth, the term natural, a lot of women, when they use the term natural, what they mean is it is a vaginal birth. And we just don't use the term vaginal because vaginal seems vulgar or something. And so people like to say natural. However, some people relate to the word natural as being unmedicated. But actually not all women who would consider themselves having a natural birth actually had an unmedicated birth. So really the term natural refers to having a vaginal birth. The other side is a surgical birth. A surgical birth refers to a cesarean birth or a C-section. Again, some women will prefer cesarean birth, just the terminology, because it is a birth. It's not just a surgery. It's just that kind of birth. So surgical birth is a term I've heard, and then cesarean birth. But C-section is probably what we most often hear, but maybe some women might not like that term. Okay, so those are 2 forms of birth. 2 forms of birth, natural versus cesarean, and that is vaginal versus surgical. The second terminology is medicated versus unmedicated. So a medicated birth is going to be a birth that used pain medications, including narcotics or epidural. And I actually have even heard women consider their birth medicated if they were induced. Even if they didn't use pain medications, some women will still consider their birth a medicated birth because they use medicine to induce their birth. And an unmedicated birth would be a birth that did not use any form of medication or specifically pain medication. So in the same sense that some women who had an induced birth would consider themselves medicated, I would say there's women who had an induced birth and didn't use pain medication who would also consider their birth unmedicated. So some women will say that it was medicated, others unmedicated, even though they might have had very similar experiences to what they used in birth. So medicated is when you, specifically for most women, is when you use pain medications in birth. Unmedicated is when you don't, and some women would specify for induction as being medicated rather than unmedicated. So those are the 4 ways to talk about birth: natural, cesarean or surgical, medicated or unmedicated. And yeah, I just wanted to explain that to you guys so you understood better. And do be aware of how you talk about birth, especially if you're a doula or a birth worker. The way that you talk about birth does influence the woman you're with, and she can have feelings around that. So just be aware of that and try to be mindful and caring for people and how you explain birth and talk about birth with them, because every birth is a birth, no matter how you did it, and no matter if you used medicine or not, or if you had surgery or you didn't, it's all birth and it's all beautiful, and we need to love and accept each other in that. So thank you guys. Have a great day.